Hello, my name is Angela Schofield and it's my privilege to be the Chairman of Harrogate and District NHS Foundation Trust. I'd like to welcome you to our annual members meeting this afternoon, which is our opportunity to reflect on the financial year 2019-20. Throughout this evening, a number of colleagues will share their experience of working during the pandemic, and we're going to start by hearing from two patients who were cared for by the Trust, Andrew Cartledge and April Martin. April is the Mayoress of Harrogate and she's joined by her husband Stuart, the Mayor, and I would like to thank them both for their fantastic support to colleagues here at the Trust during the pandemic, and it was a really great pleasure that they came and led the final NHS clap for carers with us at the hospital.
I first thought I was heading for trouble with COVID back in March. I'd felt unwell for a few days, thought it was a chest infection. I'd had several antibiotics but didn't seem to be really fighting it, and I thought I need to go to the hospital. High temperature and everything, breathlessness, and on admission in hospital it was a frightening experience to be met by about 6 or 8 doctors and nurses, all with the gowns and the visors and the masks, and but at that stage I never envisaged that 5.5 weeks later I would still be there. It was a frightening, scary experience. I moved around from several wards. I was probably in about 5 or 6 different wards, and a whole week in ICU is probably the only time that I really didn't realise where I was and what was going on around me. I knew I'd got fantastic 24-hour care, but I was mightily relieved when the day they said, right, we're moving you back onto the ward, and then even better when I was released onto Wensleydale ward. It's scary because there's nothing to relate it to. I often say if I'd broken my leg and had gone into hospital, you would know that several weeks later the doctor would come along and say, yeah, okay, you're fit to go, everything's okay. Every time during my spell in hospital, I raised a question, I was virtually told the answer, we don't know, before I'd even finished the question, because the doctors and nurses were obviously learning on their feet, so to speak, because of this virus was new to them as well. You can't emphasise enough the pressure and the fear that it has on the family at home, because with no visitors being allowed in hospital, they were reliant on a daily call from a doctor or a nurse just to put them in the picture. But even then, they didn't know exactly how well. I'd talked to them on the phone, and my voice wasn't good because part of the symptoms of the virus is your voice is husky. It's still 20 weeks after coming home, my voice is not 100%, and after talking for quite a while, disappears. But it's awful for the family at home because they really don't know what's going on.
Okay, so I started with coronavirus symptoms very early on in March, and I was determined that I wasn't going to go to hospital and stayed at home. So I stayed at home in bed, feeling absolutely terrible. The symptoms that everybody has been talking about, headaches, coughs, breathlessness, just feeling really lethargic, not being able to do anything. My symptoms steadily got worse, and we called 111 and they arranged for paramedics to come out, and this would probably be on about day 7.
Wednesday.
Yeah, about day 7.
Yeah.
And the paramedics came out, and although I was poorly, they said I wasn't poorly enough to go to hospital and to just carry on as we were doing, which was fine. I really didn't want to go to hospital, but I needed that reassurance. By day 10, I couldn't get out of bed, I couldn't get to the bathroom, my breathing was so bad. We phoned our GP, she told us immediately to phone paramedics, which we did, and they came and blue lighted me into hospital. I And it was only when I went into the resus room at hospital that I realised that I was as ill as I was. The staff there were absolutely fantastic. They brought a CPAP machine over from York for me, and I was told that if I had to be intubated, that if my heart stopped, I would not be resuscitated. My lungs were in such a poor state. So, and even then, it was, I think because I was so ill, the seriousness of that just didn't register with me. Once I'd been stabilised, I was taken up to ITU. And to be fair, I don't remember an awful lot of my time in ITU. I was there for a few days before I went on to the ward for another couple of weeks. On the ward, well, the staff just, I wouldn't be here without them. Without all of Harrogate staff, I wouldn't be here. They were absolutely fantastic. Nothing was too much trouble. But I have to say that the porters, the domestic staff, were the ones that really had the time to keep my spirits up. And they all just had that little bit more time than the medical staff to just gee you along, really, and keep you in touch with what was going on in the real world.
It wasn't the easiest time in my life, I have to say. We're a close family. I have two daughters. We have two daughters live relatively close to us. So we're not only close as a family, but we were close physically, in close proximity to each other, and not being able to go to either one of them and give each other a hug, doing everything over the phone, was very difficult. When we loaded April into the ambulance, didn't really realise that could have been the last time I ever spoke to her.
I still get tired, although not as tired. It is improving, and I occasionally get flashbacks into the time that I was in ITU. But hey, like I say, you know, I wouldn't have been here had it not been for the staff, and you know, we want to thank them, don't we, from the bottom of our hearts for everything that they did.
It has to be said that last night you had a flashback.
I did. The first time for ages, I woke up in a cold sweat, in tears, trying to get the mask off my face, which obviously wasn't on, but at the time I believed it was. Obviously we're very, very careful about wearing masks and using sanitizer, and I think initially the general public were as careful. I do think recently things have become a little bit more complacent. People expect that it couldn't happen to them. It happened to me. I didn't have any underlying health conditions. I was fit and well, and I don't know why it happened to me. You've got to respect it. Try and keep safe as much as you can.
Well, thank you very much again to Andrew and April and Stuart. We'll now start the formal business of the annual members meeting. This is the first time we've held our annual members meeting using video conferencing. So we've got our fingers crossed that it will go ahead without any hitches. I think we've already had a little hitch at the beginning. Many of us in the Trust have become quite familiar with this technology over the last 7 months, and we do know that something usually goes wrong. And the key is not to panic. Normal service will be resumed. You will be able to see those of us who are speaking, but we can't see you. As well as this being an opportunity for us to share what's been happening with you over the last year or so, there's always also an opportunity for you to ask questions. But because this is a live event, we won't be able to hear you. So we need to ask you to use the chat box function, which is on the right-hand side of your screen. You can get this by clicking on the icon, which looks like a small rectangular speech button in the middle of your screen across the toolbar. Please do this as we go through the meeting, and at the end of the presentations, I will put as many of the questions possible to colleagues here at the Trust. And if we don't manage to respond to all questions, we'll put the answers on our website. As you know, we've not been able to invite members to our face-to-face meeting this year to comply with the requirements for social distancing. I hope you will find the meeting today as informative as usual. We'll be very pleased to receive your feedback to see how we can improve on this in the future. We've circulated the agenda in advance, and hope that you've been able to access this. This annual members meeting is a very important occasion where we formally report to you, our members, for the Trust's performance in the previous financial year, 2019-20. Technically, the year from April 2020 is beyond the scope of this meeting. However, we know how very important the last 7 months have been, not only for the Trust, but for the NHS as a whole. So we are including video presentations which capture the experiences of working through the pandemic. These will be interspersed between the formal business of the meeting. I cannot say too loudly or for too long how absolutely magnificent every single person who works for the Trust, who volunteers for the Trust and raises funds for the Trust has been and continues to be through these very difficult times of great anxiety and uncertainty. The Board of Directors and Council of Governors are full of admiration for the selfless care and professionalism of our colleagues during a period when every single one of them has had great personal concerns. The support we have received from members of the public has been uplifting and heartwarming. The weekly Clap for Carers was a wonderful demonstration of community support, and it is very moving still to see rainbows outside schools, in windows, painted on stones, everywhere you look. So many people, individuals, businesses and other organisations have offered help in a very wide variety of ways. We have been overwhelmed by their generosity and kindness. If I started to mention them all, I'd still be here for a very long time. As we go through the meeting, please can I ask you to keep in your mind's eye the full range of services which the Trust provides. It is not surprising that hospital services have been at the forefront of everyone's thoughts during the last 7 months. However, we are also proud to be responsible for community services for Harrogate and the rural district and in the wider North Yorkshire. Colleagues in those teams have been working very differently and have supported many people at home who otherwise would have come into hospital. We're also very proud to provide services for healthy children from babies to 19-year-olds in North Yorkshire, County Durham, Stockton-on-Tees, Darlington, Middlesbrough, Sunderland and Gateshead. They too have developed very different ways of working to support families safely. We also have a wholly owned subsidiary company called Harrogate Integrated Facilities, which was created in 2018. Our wonderful colleagues there provide a range of services, including estates and facilities management. In a minute, we will conduct the formal business of the meeting when Steve Russell, Chief Executive, will present his report and Jonathan Coulter, Deputy Chief Executive and Director of Finance, will present the annual accounts. Before this, I would like to give some thanks. Some board members left us in the period to the end of August. Leslie Webster and Chris Thompson were highly knowledgeable and experienced non-executive directors who came to the end of their term of office. We have welcomed 3 new non-executive directors, Jeremy Cross, Andy Papworth and Wallace Sampson. David Scullion, Medical Director, left the board in May, and Dr. Jackie Andrews is our new Executive Medical Director. Rob Harrison, Chief Operating Officer, moved to South Tees at the end of August, and his interim replacement is Tim Gold. I would like to pay tribute to the board. They are an outstanding team who are absolutely committed to serving patients and supporting all our colleagues with kindness and care. Philip Severs stood down as Chairman of Harrogate Integrated Facilities and has been replaced by Mark Chamberlain. I'm very sorry to report that the Patient Voice Group, who have been providing independent support and feedback from patients for many years, have disbanded. They have been a very important part of the Trust and are greatly missed. We have a very active charity, Harrogate Hospital and Community Charity, which is supported by many individuals and organisations, including the Friends of Harrogate Hospital. They have worked very closely with a wide range of people who have offered support over the last few months and have also ensured that donations and practical help have been used to the best effect. I'd also like to just say a word of thanks to the Friends of Ripon Hospital, who are also great supporters and do tremendous good work to support patients and colleagues who work there. Claire Cressy will report on the members of the Council of Governors who have left us and those who have joined the Council. However, I would like to say a big thank you to the Council for their tireless support, which they give completely voluntarily. In particular, I would like to thank Emma Edgar, who took on the role of lead governor until the end of 2019, and to Claire Cressy, who has taken over this role and is providing great leadership. Finally, I would like to thank the team who have organised this meeting, particularly Elaine Culf, Lynn Hughes and Paul Widderfield. My last word of thanks go to the absolutely wonderful people who are Harrogate and District NHS Foundation Trust. They are truly outstanding. We are all aware of the ongoing uncertainty about the spread of coronavirus and the impact it can have on local communities. Please take great care, continue to follow the measures to control the infection and follow the government's guidelines. At this point, we would normally receive the minutes of the previous annual members meeting. The minutes of that meeting held on 24th of July 2019 have been approved by the Council of Governors and are available on the Trust's website. Shortly, Steve Russell, Chief Executive, will talk through some of the broader achievements across the year, but now we're going to hear from Vicky Holloway and Rebecca Lee, two of our consultant colleagues, about their experiences during the very initial phase of the pandemic in late February and early March.
So, where to begin? It's been an incredibly difficult year. We were faced with a new disease, none of us knew what to do. We started getting a few patients through the doors when the pandemic started, and we just didn't know what to do or what to expect or how to treat the patients. There was a lot of conflicting information internationally and nationally about what to do. And luckily some of that guidance was collated and we got guidance from the college on how to treat patients, which helped eventually, and also we got to recognise what we were looking for with the disease, because obviously it's something none of us had ever come across before. Trying to rearrange the way we worked was incredibly difficult. We had to get used to PPE. We had to fit everyone with PPE, do fit testing with masks, learn to wear gowns and goggles, visors, gloves. So trying to look after people with a new disease was really difficult. None of us had come across this before. It's a bit like flu, but it sort of isn't. And patients that we thought might have COVID didn't, and patients that we didn't think had COVID did have it. And there were different presentations in different ways, and we had an awful lot of learning to do. I don't think I've ever done so much reading around one disease in such a short period of time in my life. Eventually the team kind of got an idea of how to treat these patients, but internationally there was lots more information coming through, literally on a daily basis, of changed treatments and different options of how to treat people. It was very confusing, conflicting advice and difficult to manage. But we pulled together. The team was amazing. We had co-opted staff from day surgery and endoscopy, had aspirant nurses who sort of came to us before they qualified, and we all pulled together really well. Trying to communicate behind masks is difficult with each other and with patients, and we had to learn how to communicate as a team, which had been pulled together really in the last minute, so people that we'd never met before we were working with, but everyone integrated really well, and we sort of just did the best we could under very difficult circumstances. There was a lot of anxiety from staff about contact with patients. The media obviously was a frenzy about the dangers of COVID, and people were really worried. A lot of staff had their families worried about them, didn't want them to come to work, and trying to support them and sort of remain safe with PPE was a real challenge, especially again in the early days with the PPE shortages nationally. I think luckily at Harrogate we didn't have too many shortages, and we had the kit we needed, but there was so much anxiety with staff. I think the other thing that was quite eerie was coming to work through empty streets. You felt like you were the only person on the planet, and you come into the hospital foyer was deserted. Come to work and you were this little bubble, and it felt like you're on Mars or something, just completely isolated. But one thing that was incredible were the gifts from people, cakes, coffee, pizzas, the things that people dropped off, and that kindness from strangers was absolutely amazing. It just kept team morale going. So if any of you sent in anything to us, massive thank you, because it really, really helped.
My normal day job kind of came to an end on the Tuesday the 10th of March this year. I came to work that morning knowing that I was going to be speaking to the staff on my ward to say we were expecting to change from being the orthopaedic trauma and rehabilitation ward into the COVID admissions ward, and that we were making some plans for that. And within 6 hours, in fact, our first patients were coming in, so it all happened much quicker than we expected, and at that point it became very clear that everybody was very frightened. We were all really apprehensive. We didn't know really what it was going to look like. Was it going to be like what we'd seen in Italy on the TV screen? And we really at that stage we're still working with relatively small amounts of clinical information about this evolving disease. I was scared. Everybody I worked with was scared, and yet we had to try and support each other, and it became really, really clear at that first stage that the only way we were going to get through this was by working together as a team and supporting each other and looking out for each other, not just in terms of support for our jobs, but looking out for each other in terms of making sure we were doing our PPE correctly, that we were checking up on each other as we went into and left a room, that we were sharing jobs, so that we were making sure that transit in and out of the room was minimised as much as possible, but whilst also trying to maintain the best standards of patient care that we were able to. The way the doctors worked in the hospital changed enormously for a lot of us. So a lot of the junior doctor teams changed around completely, so that they formed these sort of super teams that worked in shifts. The medical consultants formed a group of 14, of whom there was 2 consultants who were sort of the duty consultants throughout the day, and we changed again our working patterns entirely. So there was no Monday to Friday, then Saturday and Sunday. It was just a 7-day week, and we all had a new shift pattern to work within that. And our surgical and orthopaedic and other colleagues supported that by this more senior grades within those departments stepping down into more junior roles in order that they could release their junior doctors onto the COVID wards. So it was a massive team effort within the medical staff, as well as the enormous team effort that was going on throughout the hospital. I have never been as proud of the team that I've worked with as I was during that phase. During the whole of the COVID period, one of the things that we were all very conscious of was that our relationship with our patients was changed because we're behind the PPE, and because our patients couldn't have the visitors that they normally did, and for a lot of them who were very, very poorly, they needed a lot of support, and that touch, the close approach simply couldn't be there, and it was difficult for us as staff caring for them. I think all of us were very conscious of how difficult it must have been to be a patient during that period. And even now that continues, because we're still wearing all the PPE, but that during that particularly acute period when everything was very busy, was very stressful, was very hot. It was very hot at times for us and for the patients. And I think a lot of the things that we will remember and retain were the difficulties we had sometimes in having that human relationship that's so fundamental to what we do when we're dressed up in the PPE and in that stressful situation.
Hello, good evening and welcome to our annual general meeting. My name's Steve and I am privileged and honoured to be Chief Executive here at Harrogate and District Foundation Trust. I've been here for just over 18 months and watching those videos back reminds me and all of my colleagues why we all joined the NHS. And never, like everybody else has said, never before in the 22 years that I've been part of the wonderful national institution have I been prouder to play a part in the wonderful service that is our national treasure. I want to take you through some of the highlights of the year, and so you'll have spotted that we've had the odd technical hiccup as we've gone through this so far, and I'm probably about to precipitate a second technical hiccup as I try and share my screen with you to walk you through a few slides that hopefully will describe some of the highlights of 2019-20, which is a year that none of us, no matter whether we work here or whether we're a resident here, will ever forget. I'm hoping that you can see a set of slides, and I will now just try and talk you through that. So, as Angela said in the beginning, much of this year has been dominated by coronavirus, but also the first 3 quarters of the year was, I suppose, a relatively normal year for the NHS. And I want to spend a little bit of time sharing with you what we've been up to on behalf of the communities that we serve. And I want to start with a very big thank you to our 4,500 colleagues across HDFT, our colleagues in Harrogate Integrated Facilities, who together have nearly 30,000 years of experience and service to the NHS. And for many of those colleagues, much of that experience has been right here in Harrogate and across the North East and North Yorkshire. In every year, our colleagues give about 7 million hours of their time to care for patients across our geography and their families. And it's a really important point to start with to say an enormous thank you to them, because in the end, HDFT is simply the sum of the parts of all of our absolutely fantastic colleagues. 2019-20 has been a really busy year for the Trust and all of our colleagues that work in it. And as I said, the first 3 quarters of the year was a relatively normal period for us. And that said, we were busier than ever, and just to draw out some of the key highlights for you to illustrate that, as Angela said, we're very proud to provide services to children and families across North Yorkshire and the North East, to try and make sure that they get the best possible start in life and that they can therefore achieve their full potential. Over 750,000 contacts took place with children and families across the year. And our adult community services that Angela referenced earlier gave 150,000 treatment episodes in patients' own homes right here in Harrogate and District. We often talk about the hospital, as Angela said, but those numbers eclipse the amount of activity that took place here at HDH, notwithstanding how important that is. We saw just over 50,000 patients through our emergency department and did nearly 40,000 operations or day case procedures. And although the NHS faced a number of pressures through the year, as we did here at HDFT, our overall performance in terms of waiting times remained better than average and very strong. Over 90% of patients were treated within 4 hours. We exceeded by a significant margin the cancer standards, and hopefully you'll see that patients who used our services were generally very satisfied with the care, kindness and compassion that they received when we looked after them. That doesn't mean that we've got everything right, and of course every year we learn from our own experiences and the experiences of people that we care for, and every year we learn how we can do things better for each and every one of the people that we look after and whose care is entrusted to us. In addition to concentrating on the day-to-day activities across the organisation, from right here in Harrogate up to Gateshead in the northeast. We also thought, together with our partners in Harrogate and District Clinical Commissioning Group, we spent some time thinking about our future and how best we could meet the needs of the patients that we serve in the future. And that really boils down to the work that we'll be taking forward over the next year, which looks at improving the way in which we support older citizens to keep fit and well and independent in their own homes, and also how we work in partnership with our other partner NHS organisations, particularly in Leeds, around some of our surgical services, to make sure that we can continue to offer the very best treatment for people who use the services right here in Harrogate. We're passionately committed to thinking about health and well-being in its total form, and we were very, very pleased to be able to launch a service called Active Against Cancer, which is hopefully shown on the slide at the moment. Active Against Cancer is a pilot and is made up of an incredibly committed and passionate group of 10 colleagues who are physical trainers and experts in health and well-being. They launched the service on the 15th of July, and that ran until the 19th of March, when it obviously had to be paused as a consequence of the pandemic. But during that time, they looked after 624 patients to help them either prepare for or recover from treatment from cancer. Despite the challenges posed by the coronavirus pandemic, they continued to support people and assessed over 100 people on the phone, giving advice and support and guidance. I had the privilege to join some of their classes and was roundly beaten by other participants who were doing much better at the exercises than I managed to do. And I wanted to share two quotes with you. One is from Tom Collier, who is a consultant anaesthetist who works in critical care here and was the clinical lead for this service. And he talks about the benefit of exercise, both in terms of our overall health and well-being, but very specifically in terms of the better outcomes that people are able to achieve if they are going through surgery and are able to exercise and optimise themselves before having surgery. He says a phrase that has always stuck with me, which is, if exercise was a pill, every single one of us would be prescribed it. And when you talk to some of the people who have used the Active Against Cancer service, they talk not just about that, but also about the impact on their overall health and well-being. And I thought I'd just read you a quote from one of the patients who used it. And they said, "When my treatment ended, I felt quite alone until I joined the Active Against Cancer programme. The brilliant instructors get to know everyone as individuals and ensure the training is tailored to each person's needs. This is much more than an exercise group. It's a whole community that helps patients recover both physically and psychologically from the diagnosis through treatment and beyond." And another patient who was in one of the classes said, "I was at a stage in my life when I was having treatment and sitting at home looking at four walls. Life was miserable and lonely. Active Against Cancer was like utopia to me. Since starting the classes, my life has improved to such a degree that at times I forget I have cancer and I'm having chemo. The staff have made my life worth living again." We're really therefore proud that the service has resumed and the colleagues in Active Against Cancer are continuing to support people as they go through their cancer journey. We also launched a service together with our partners and friends in North Yorkshire County Council, which is called HARA. It's the Harrogate and Rural Alliance. And that brings together a number of our community services and social care services. There are over 180 colleagues working in HARA, and they are currently supporting nearly 3,000 people in their own homes, helping them to keep well and independent in their lives and their daily activities. We're incredibly fortunate to have been able to launch this unique enterprise, and the teams are working really closely together to try and share experiences and skills and to reduce the duplication that some of our patients see, and ultimately to improve the outcomes that we're able to achieve for those colleagues who are in their own homes. Alongside them, colleagues in our supported discharge service looked after between 20 and 30 people who would otherwise have been in a hospital bed throughout the year, which again is better for those colleagues and patients and their families, and helps reduce pressure on the hospital site. As Angela said earlier, we've all had to get used to digital in a very different way. We still struggle with the technology, but I also wanted to mention some of the work that our colleagues in the IT team, led by Matt Shepherd, have been working on this year. We've been doing a lot of work to try and integrate all of our systems into a single view so that clinicians can see all of the information that they need to in one place about our patients. There's still a long way to go, but we've made quite a lot of progress this year. The observations that we have about patients, the results that we have in terms of blood tests and X-rays are now all available in our system, which is known as WebV. The team have also deployed lots of technology to try and help make people's working lives easier. So we've been piloting some voice-to-text digital solutions to avoid people having to write, making it easier, and also making that information available more quickly to team members, which ultimately means that we know more about a patient and we're able to better meet their needs whilst they're with us. Over 65% of our IT devices have been upgraded through the course of this year, as we start to deploy new software and try and upgrade some of the technology that we've got. And it would be remiss not to mention the very special role that IT colleagues have played during the pandemic. They've had to roll out different technology, they've had to teach us how to use it, they've had to roll out new devices and support colleagues to work at home in a very different way than we've been used to. And they've done that under great pressure, but always with a smile on their face. And despite the pressures that they were facing here at HDFT, at the time that they were needed, they stepped up and supported the establishment of the Nightingale Hospital down the road, which was a huge challenge that they rose to very, very quickly. So it's a really important point to recognise not just those colleagues that you've seen on the videos who might be in the departments treating patients, but those who are perhaps less visible, but without whom we absolutely could not do our work. This weekend a year ago feels like a very long time, but many of you will remember that in September we welcomed the world to Harrogate as part of the UCI Cycling Championships. Megan and Fran, who are pictured in the picture, had lived the preparation for UCI for over 18 months. One of their reflections was that as we did the work to prepare for the cycling championships, we became much closer to our partner agencies and we learned a lot about each other to the benefit of our services on an enduring basis. Many of us got to see the cycling that was rather wet at times, and it was really important to recognise the extra mile that our community service colleagues in particular went during that time. Roads were closed, they couldn't use their cars, and patients in their own homes still needed looking after. And there's a little montage of some shots that were taken of our colleagues during that time as they got on their bikes, they walked, and they trudged through enormous puddles and rain to get to people in their own homes to keep looking after them every single day. As I said at the beginning, we are the sum of our parts. We are the sum of the colleagues that work at HDFT, and we were able to celebrate a number of our long-serving colleagues. Over 200 people have 25 years or more service to the NHS during this year, and we were able to bring them together to thank them for their commitment, kindness and enthusiasm. And there was one colleague in particular that we felt a special thank you was due to, because Monica, who's pictured here, served here at Harrogate for over 50 years, and she finally retired from the trust last year. She joined us from Trinidad as a student nurse and has worked here all her professional life in a number of different roles, but spent much of her time in the emergency department. And she's already a huge miss to us, and she was a fantastic role model for many of all of us in the trust. As we said, we're only able to do what we do because of our wonderful colleagues. And we've tried to pay particular attention to developing them and supporting them through 2019-20. HDFT is simply the sum of its people in terms of what we're able to achieve. And so through the year, we launched a couple of programmes specifically around supporting particularly our first line leaders to supervise the teams that they lead with kindness and compassion. A number of our colleagues went through the RCN Clinical Leadership Programme, and as I say, we launched what we've called the First Line Leaders Programme, which is about equipping all of us to do our jobs in the best possible way and in a way that meets the needs of our colleagues and therefore our patients. I mentioned that in September, Harrogate welcomed the world as part of the Cycling Championships. We're very, very proud to be made up of a large number of colleagues who are from around the world. And one of the great things about HDFT is the diversity and difference of backgrounds that we have in our 4,500 colleagues. And during the year, we celebrated that diversity and made a promise to people that work in our organisation that no matter what their background, they'll be treated with kindness, they'll be treated fairly, and they'll be treated equitably. Over 60, we have colleagues from over 60 countries. The slide says 56, it's now 60, from across the world. And we know that some of our colleagues from different backgrounds don't always have the same experience. And we're very committed to making sure that those differences in experiences are equalled out. We launched the Rainbow Badge Scheme, which is a pledge around LGBTQ plus colleagues and to patients and their families that we look after. And that is that people can feel safe and supported to be themselves and that we will talk to them about their particular needs. Our board led the way with every single board member signing a Rainbow Badge pledge, and over nearly 1,200 colleagues now proudly wear that across the trust. Angela mentioned our charity, which continued to be very, very active. They're a small but incredibly passionate team and did a huge amount of work during 1920, ranging from putting concerts on to a photo competition, to the 3 Peaks, which they signed me up for without me knowing that that had happened. And one of the most fun events that I think I've ever seen, which is pictured here, known as It's a Knockout, which provided a welcome relief and quite competitive behaviour between teams from across the trust. They also got very wet and they're looking forward to hoping to be able to run similar events in the future, respecting the fact that many of those will need to be tailored to the circumstances that we're in. As well as being a bit of fun, all of those activities helped raise much needs funds for our services. And in 1920, nearly £700,000 was raised. So a huge thank you to them, but also to any of you who might have supported the charity during the course of the year. You're able to support in lots of different ways, including the Amazon Smile account that we have. So please keep an eye out for the activities that they are undertaking. And then finally, in February and March, every single colleague across HDFT stepped up and sought to prepare for what the pandemic would bring. As you've heard, we didn't know what that would be, and every single person ended up changing the way that they worked and preparing to support people in very, very different ways. Pictured here is our ITU team, who obviously had a particular focus in terms of preparing for potentially large numbers of patients who needed critical care. But as Angela said, this wasn't all about hospitals. Many people were shielding, people were in lockdown, and they needed ongoing care, support and attention in their own homes. And you'll hear a little bit later on from colleagues in some of those teams who adapted their way of working during the pandemic. So as I started, I'd like to finish with an absolutely heartfelt thank you to every single one of our colleagues across North Yorkshire and the North East, who have worked so passionately, kindly, and with such enthusiasm and drive, but through very, very difficult circumstances. I hope that for those of you who've used our services, you've felt their kindness and compassion in the experience that you've had with us. And I'd also like just to take the opportunity to say a thank you to my board colleagues, and in particular my executive team colleagues, without whom I simply wouldn't have got through the year either. Up next will be Jonathan Coulter, who's Deputy Chief Executive, who will talk a little bit more about how we used our resources through the year. But before we do that, we're going to introduce two more colleagues, Emma and Liz, who are part of our adult community service. Remember those 150,000 contacts in everybody's homes. These are two colleagues who've been doing that day in, day out and have continued to support people through the pandemic. Here's their experience.
My job role is basically going out to patients' houses, patients who are housebound who can't get to a GP service or a practice, and carrying out care in their homes basically. I've done this for 10 years in total, and basically our practice has changed quite a lot during the pandemic. We still worked through, we carried on doing our usual day-to-day care, as none of it can really be, it's all essential, but it was a lot more time consuming, a lot more donning and doffing of PPE, a lot more phone calls and prep work before we went in to see patients to check for symptoms, check for family members who had any symptoms, and obviously trying to kind of make sure that our team remained safe and look for any people who might be at risk and try and navigate who could go in and see who, which is not something, I mean, we usually do it, but it was from to a much greater extent during the pandemic. There was a lot more apprehension early doors when sort of COVID was first out and about, because obviously it was a bit of an unknown. The hospital's quite a controlled environment. There's always staff there, there's always someone there to kind of ask advice from, get information from, but because we're very much lone workers, we were basically out by ourselves, and you don't know what you're going to go into on a day-to-day basis, which is usual, but particularly throughout this, you don't know who's going to be in the house, where they've been, who they've come in contact with, what family members are there, what symptoms you might come up with, and particularly in the early days when testing wasn't as widespread as it is now, not really many of our clients had really been tested, so we didn't know if anyone was positive, negative, or what really. So it did increase anxiety, and particularly when all the PPE regulations and things came in, I think people were quite concerned about making sure they were doing it properly, where we were going to get rid of PPE, how we were going to put it on, when we were going to put it on, when was appropriate, when we could hand wash, when we couldn't, usual sort of things that tend to come up in community visits were just kind of amplified, I think, more by all the new regulations and PPE and stuff that we had to wear. The patients and the clients they've been really understanding. There was a period where we would sort of ring ahead of time if it was something. We've got quite a few visits and quite a few clients that we see kind of annually or biannually or sort of a couple of times a year that didn't necessarily need to be seen at a particular time. So we'd liaise with them, and most people were really understanding of what was happening and kind of didn't want us in their house, but we're quite happy for stuff to be delayed to a couple of weeks later, a little bit further down the line where needs be. I think for us in the team, it's been a new way of working. We've had to incorporate quite a few different ways of keeping in touch with the social distancing and everything. Usually most of us would come into the office on a morning, we would collect and stop, have a bit of a handover, pick up our lists, go out, come back at lunchtime, have a face-to-face handover. So we'd be in contact with each other face-to-face quite a lot. But obviously we're trying to limit the amount of people in the office, limit our sort of contact with each other. So we've had to utilise Teams a lot more online handovers, working out from our cars, working from different bases. So there's been a lot of adaptation really.
It's been a really interesting last few months, and we've had to completely redesign our service to meet the needs of patients during this time. Our manager was fantastic because we're based in the community, and it's really important that we stayed in the community because most of the patients with COVID are out in the community and their families. So we looked at our service and thought, how best can we meet their needs? And what we did was to prioritise who needed to be seen at home, and changed a lot of what we're doing to telephone contacts. So we ran lots of telephone clinics. We were a hotline for anybody who had any concerns, and that looked very different because we thought there'd be a lot of physical concerns, and actually there were a lot of psychological concerns. Patients were very anxious about COVID, and there was a lot of bereavement as well. So it was quite an interesting time for us. So patients with heart failure who are referred to us, that could be from the GP, that could be from the outpatient department, self-referrals. We will see them, we will devise a management plan for them, we will optimise medication, help them get their head round what's going on, but more importantly as well, we try and enable them to manage their condition themselves, which reduces the chance of them becoming unwell and helps them recognise really quickly if they're becoming more symptomatic with their heart failure. So hopefully we can prevent admissions for them. We run lots of telephone clinics now so that people have got access to us very quickly during the day. But what happened was that patients seem to become even more adept at looking after themselves. We've enabled them to become more independent, which is actually quite good. So we've learned a lot from the pandemic, that we don't have to see lots of patients every day in clinics or at home. We can actually use more telephone services and be there for the more acutely unwell patients. So it's actually been a learning time as well as quite a challenge. Most patients have been very understanding. What we didn't realise was just what a psychological impact the pandemic was going to have on our patients. In the start, lots of people died, lots of relatives died, and patients were locked down, isolated and desperately lonely. So the fact that we could visit wearing PPE was really important to them, and we spent a huge amount of time on the phone listening to patients and trying to get a feel of how life was for them. So yeah, it's been a difficult time for many people. It's yeah, you realise that people matter hugely and that people are really going through it, and Sally and I have worked really hard together, and I think we're coming out the other side now. But yeah, it's a few months we won't forget, and of course we're not through it yet, so hopefully it'll be okay.
Hello, my name is Jonathan Coulter. I'm the Finance Director and Deputy Chief Executive of Harrogate District NHS Foundation Trust. Pleasure to be talking to you tonight, even though it's remote. I'll be going through the financial performance of last year, so I'll just share my screen with you now and take you through a few slides. Hopefully you can now see my slides. So in terms of the financial performance for the year, I can't avoid giving you a couple of numbers. So this is a financial presentation. So just a couple of numbers for you there. You can see we earned about £270 million worth of income, and we spent about £270 million of money during the last year, which, if you say it quickly, doesn't sound quite as big, but effectively that's about £750,000 a day, or about £30,000 an hour that we use to provide all of the services that we provide across the geography that we provide them. And at the end of the year, we had a surplus of just over £400,000. Now, this was below our original plan as a surplus, but through the year we had a number of discussions with our regulators and with our local integrated care system of West Yorkshire and Harrogate, the group of organisations across West Yorkshire and Harrogate region, and agreed a revised financial target, which we then did achieve by the end of the year. And this partial achievement is reflected in the financial risk rating that you can see there, where we had a risk rating of 2, where 1 is very low risk financially and 4 is a very high risk. So just a bit of context and a bit of narrative behind our financial performance last year. As mentioned, across the integrated care system, across West Yorkshire and Harrogate, we worked really well together to ensure that collectively we all delivered the financial performance for the region. That demonstrated the strength of the partnership and the maturing relationships, which helped manage the financial risk for all of us, which was great. Also, very positively, we delivered an efficiency programme during the year, so we made cost savings during the year of over £8 million, which is really positive and a credit to all of the staff and all the colleagues who've been involved in that work over the difficult year we've had. We managed to invest over £4 million in terms of our capital programme, largely in bits of medical equipment and IT development. I think I'd be kidding you if I said that that was enough. I think we'd all like to invest more money in our estate and our IT and our equipment. And that's one of the challenges we face over the future years, to be able to generate enough cash to be able to invest further in the organisation. And whilst we did have a balance of cash at the end of the year of just over 3.7 million, this is only about 5 days worth of money. And therefore it's been a challenge all year to manage payments in a timely way. We did take out a loan at the back end of March to pay off some of the older invoices, which was really, really helpful. But again, 2019-20 has been a challenge financially and in terms of our cash. And then again, whilst not material financially in 2019-20, we did start our response to the COVID pandemic during the month of March. And it did disrupt the usual processes and governance processes and the preparation of year-end accounts and reports. Having said that, we did obviously prepare a set of accounts, albeit with people working remotely. And in terms of the audit of our accounts, I'm pleased to report that external audit issued an unqualified opinion and was satisfied that our annual report was consistent with detailed financial accounts. That's as good as it gets from audit, so you can cheer and clap at that point. You don't get much better than that. And Maureen, our deputy chair, will go through the work of the audit committee in this process a bit later on after myself. Now, if we look forward into 2021, or the year that we're currently in, financially, as well as everything else, it looks very different. We have a new financial regime, and in the first 6 months of the year, we've been able to claim the money required to cover all of our costs. So the costs of managing the COVID pandemic. And in terms of the COVID costs themselves, things like PPE, things like covering staff at times of increased sickness, things like testing, we're currently spending about £1 million a month, which is something we would never have planned on even as early as February last year. In terms of cash, I've just gone through the challenges that we had last year. We are now receiving our money a month in advance, so we can support local businesses and hopefully support the local economy by paying suppliers quickly and getting money from the NHS to contractors as quickly as we possibly can. I've already mentioned capital and how we'd love to be spending more on capital and investing in our equipment and our estate and our IT. Well, we've already spent more on capital this year than the whole of last year, and we've got funds and plans to spend more on schemes to upgrade the critical care unit, the emergency department, and purchase some more medical equipment over the second half of the year. Finally, I suppose, in terms of the financial look into 2021, whilst the new rules in the first part of the year have been really helpful to facilitate a quick response to the COVID pandemic, there is still a lot of uncertainty in respect of what the future will bring in terms of the resources available to us and to the wider system and nationally, I guess, as well. But I do appreciate that this is quite a small subset of the general level of uncertainty about the impact of COVID going forward. So just some final thoughts from me, really. I suppose the first thought is that 2019-20 seemed a long time ago. It is only 6 months ago. Normally we're presenting the annual members meeting and it doesn't feel too long ago that we're reporting on things that we've just done. It seems an age ago, and the world seems very, very different now than it was then. Lots has changed, priorities in a number of ways have changed, resources have changed. I suppose in spite of all this, from my perspective though, is what stays the same. And what's really, really important is that, as ever, we provide the care, support, advice to the population who rely on us, often at a time of personal vulnerability, and our focus, which is always there but heightened in these challenging times, is to organise ourselves, our services, our system to provide the best that we possibly can. So I'd just like to add my thanks to all colleagues who, despite all of the changes and all of the challenges and uncertainty, continue to do just a fantastic job across the whole trust. So thank you very much. I will now hand over to Maureen, our Deputy Chair and member of the Audit Committee, to provide some further comments from her perspective.
Hello, my name is Maureen Taylor. I'm a non-executive director at the Trust. I'm the Vice Chairman. I chair the Resources Committee and I'm a member of the Audit Committee. I'm just going to tell you a little bit about the role of the Audit Committee in the annual accounts process. There are a number of controls and stages in place to ensure that the Trust financial statements at the end of the year can be relied upon. The Audit Committee meets 6 times a year. Our external auditors, who are KPMG, are in attendance at all the audit committees, and the Audit Committee meets separately with both internal audit and external audit periodically so that issues can be discussed. There's a programme of work that's carried out by internal audit throughout the year to assess the effectiveness of the Trust's internal control framework. The Audit Committee oversees this programme of work, and they ensure that any internal audit recommendations are actioned by management, thereby giving us the assurance of the integrity of the Trust systems and processes. 3 of the Audit Committee meetings usually take place in April and May each year, and these focus on the year-end reporting. For this year, the year-end meetings were slightly different. We had one in April, one in May and one in June. First of all, there's an informal meeting of the Audit Committee where the draft accounts are considered before they are submitted to NHS Improvement and to the external auditors. And this meeting took place on the 27th of April. Audit Committee then saw the accounts again at its formal meeting on the 5th of May. And then again on the 19th of June, we saw the accounts, and we also considered the annual governance statement, the annual report and the annual accounts. The committee was able to seek comment and explanations from our external auditors, and following this, we recommended the accounts to the Board of Directors for approval. The public sector internal audit standards require that internal audit provide a head of internal audit opinion. The Audit Committee received that opinion at its June meeting, noting that there were no significant or notable control weaknesses. The external audit of the accounts was undertaken by KPMG, and as Jonathan's already stated, they issued an unqualified opinion stating that the financial statements give a true and fair view of the state of the group and the Trust's affairs at the end of March 2020. KPMG were also satisfied that our annual report and our annual governance statements were consistent with the detailed financial accounts. Together, the annual governance statements, the work of the internal audit throughout the year, the head of internal audit opinion and the work of external audit give us assurance as to the effectiveness of our control framework and hence the integrity of our financial statements. That's all I want to say about the Audit Committee. Next up is going to be Claire, who is our lead governor for the Trust, but before that we've got another short film. And this is a film from our 0 to 19 service. During the pandemic, many children and families who would have been receiving support from our health visitors and school nurses had to adapt to interacting with us differently during lockdown. In this film, we have the 2 Claires, Claire and Claire, who are going to tell you a little bit about how our services in Middlesbrough changed.
At first, obviously, we did no visits, so for the first 3 weeks, our practice completely changed to visiting all these families, and the area we work in, there's a lot of need, so there was a lot of visits we were doing above and the universal to just phone in these families, you know, whether that was weekly or at that point was weekly. We were having like obviously plans and safety plans around that, if they had social workers to kind of make sure these children on safeguarding levels that were still protected, bearing in mind they weren't attending school either, so there was no eyes on these children at all. So that was quite stressful from our point of view. So for 3 weeks we were telephone calls, and then it was we could visit these families, these safeguarding families, and the new births, wasn't it? So ladies that have just had babies who've had, you know, no family members going round, and you know, very vulnerable and lots of mental health. You know, it was, you know, quite difficult.
I think the safeguarding has escalated, and we've had lots of referrals, lots of strategy meetings, which are professional meetings. There's been a lot of mental health issues. I think we've had a couple of family members who've committed suicide within our caseload, domestic abuse, and like Claire said, just not initially during the visits, but our workload, even though we weren't doing home visits, seemed to escalate in that I found myself getting lots of text messages, lots of telephone calls, because people couldn't access other services. Lots of WhatsApp pictures of clashes.
Because they couldn't get in to see the GPs, could they? These people couldn't get to see the GPs, they couldn't just walk in, so we were the only professionals actually going in and seeing these families.
I think this area as well was, there was a high number of positive cases within sort of the main area we work. And I think there was a lot of concerns around people not socially distancing in this area. And like Claire says, that a lot of services were not doing the face-to-face contacts, and yet we were.
And I think that's been valued by our families, you know, because they've had the chance to get the babies weighed and to just see somebody's face. You know, these women have been having the babies and just having the partners turn up when they're 4 centimetres and then being sent home, and then not having family members around to come and see the babies once they're born, and that normal thing that you would do. It's I think it's been really stressful, so nice that they can actually, and that's why we've probably had an increase in text messages and phone calls and WhatsApp pictures, and even just to show you the baby and how they're progressing. I think they just wanted that contact. I think as nurses you just want to, I think it would feel wrong. I think when we went into the lockdown in 3 weeks, although some people obviously were anxious, that thing inside you, you just wanted to do your job and you felt like you couldn't do it properly over the phone. And even having meetings with the families on the other end of the phone, it just still doesn't seem right. You know, it's nice to have that face-to-face contact, isn't it?
Yeah.
You see more and you see what's going on around, and it's just not the same picking up the phone and doing that. You're not getting a full holistic assessment.
And I think some of the nice things, I had someone who walked out of a house and the appearances, how you sort of perceive someone, and he walked towards me with he had a baseball cap on, and he took his hat off to me and said respect, and
because you've been the NHS?
Yeah.
Like careful.
So that was nice.
Yeah.
Hello, my name is Claire Cressy and I am lead governor for the Trust. I too am very proud to be part of the Trust, both as a governor and as a member of staff for Harrogate Integrated Facilities. I'm going to talk to you about the work of the Council. The Council of Governors consists of 23 governors, 13 public governors who are elected by the public members, 5 staff governors elected by staff members, and 5 nominated stakeholder governors. The governors are chaired by the chairman of the Trust. Over the year, we have had to say goodbye to some of our governors. So on behalf of the Council, we would like to say a huge thank you and farewell to Pat Jones, Public Governor for Harrogate and surrounding villages, Dr. Sheila Fisher, Public Governor for Wetherby and Harewood, Michaela Lord, Non-Clinical Staff Governor, Emma Edgar, Staff Governor for Nursing and Midwifery, and also Interim Lead Governor for the remainder of her final term until I was in place in January 2020, and also Helen Stewart, who is Staff Governor for Nursing and Midwifery. We subsequently held 2 elections in 2019, and in July, the following were elected. So Samantha James and Dave Stott were elected as the Public Governors for Harrogate and surrounding villages, Doug Masterton as Public Governor for Wetherby and Harewood, Heather Stewart elected as Staff Governor for Nursing and Midwifery, Dr. Lavina Kunwar elected as Staff Governor for Medical Practitioners, and in the December elections, William Fish was elected as Public Governor for Harrogate and surrounding villages, Sue Edelston as Public Governor Sue Eddleston was re-elected for her second term as Public Governor for Ripon and the West District. Steve Trees began his second term as Public Governors for Wetherby and Harewood. Cathy McClune was elected as Staff Governor for Nursing and Clinical Staff Governor. During the reporting period, the Council of Governors have fulfilled their statutory duties by holding the non-executive directors individually and collectively to account for the performance of the Trust. As Governors, we represent the interests of the members of the Trust as a whole and the interests of the public. We appoint or remove the Chairman and the other non-executive directors. We decide the remuneration of the Chairman and the non-executive directors. We consider the Trust's annual accounts, auditor's report and annual report. We bring a perspective in determining the strategic direction of the Trust, and we are involved in the Trust forward planning process. Where there would be a requirement to do so, you can be assured that Governors are also a part of the process to approve the appointment of the Chief Executive, appoint, reappoint or remove the Trust's external auditor, approve any merger, acquisition, separation or dissolution application and the entering into of any significant transactions, and approve any proposals to increase by 5% or more of the Trust's proportion of its total income in any financial year attributable to activities other than the provision of goods and services for the purposes of the health service in England. And we would approve any amendments to the Trust's constitution. The way in which we carry out our duties are by attending and contributing at these various forums. So, such as committees of the board, we would sit and observe the Resource Committee, the Quality Committee, the Audit Committee. We attend briefings, quality of care teams, the list goes on. As part of our role and responsibilities to appoint the non-executive directors, and following a rigorous recruitment process, we were delighted to appoint Jeremy Cross, Andrew Papworth and Wallace Sampson OBE as the 3 new non-executive directors. And in addition, throughout the year of the Council of Governors has also been consulted on the Trust operational plan and the equality delivery system for the NHS. As well as continuing engagement from the Governors, we have been very grateful to receive excellent and comprehensive updates throughout the coronavirus pandemic from an exceptionally busy board of directors. So in summary, as Governors, we represent the views of the members and the general public. We ask the board questions and hold the non-executive directors to account for the performance of the Trust on your behalf. If this is something that would interest you or you would like some further information about the Council of Governors, then please contact hdft.nhs.uk or contact our membership team. Ooh. So, in addition to being lead governor, my day job is leading and managing the Sterile Services Department. Usually we're incredibly busy making sure that all equipment needed for surgery is clean and sterile. However, during the pandemic, many operations were paused, and so my team helped out in other areas. In our next film, Lorraine and Will tell their story of stepping into different roles to help us respond to the needs of patients and to the pandemic.
PPE is a service that was initially set up reactionary due to the pandemic. It was set up over literally a few days by interested individuals across the Trust and people who were unable to work within their normal workplace due to the fact that services had actually suspended. It's a testing challenge working in PPE. We're working with very little data. So what we need to do is to be able to predict the future now with our crystal ball. When is the next spike happening? Is it happening now? Are we already in it? How much PPE we're going to need? What type of PPE? Is anything going to change? I'm working with some fantastic colleagues here. Everybody in PPE team is seconded or had no work within their previous areas. And they have been absolutely amazing, really working hard. And they made me feel welcome immediately. And every person coming into the team, the ethos has been about a new team who are all going to go back to their normal places of work, but all working together for the same cause. And we have an ethos, we have a vision in PPE, giving positive colleague support, confidence and assurance in quality safe PPE at this time of concern. And that's our strapline, that's our vision, and is really important to us. Reaction from colleagues across the Trust has been very good, but obviously they've had their control of ordering PPE taken off them, which must have been very worrying for them initially. PPE is now all centralised, and we are able to give them that assurance that they will get everything and a quality item that they require whenever they need it. And we have really good feedback from colleagues, knowing that they can get what they need and when they need it. At the beginning of the pandemic, there were some really testing times regarding PPE. Colleagues didn't know whether they would be able to get what they needed. Obviously, it was all over the media that there were shortages, and that was nationally and internationally. In Harrogate, we've been lucky enough to have a reasonably consistent supply, and I don't think there's ever been a time where anyone hasn't been able to actually get the item that they really need, even if it's meant moving PPE around from one place to another. People have had what they've required, but that has been at the expense of some really, really hard work by people early on in the pandemic, but they got there and colleagues have got what they needed. We now hold nearly 2 million items just within Harrogate Trust, and that covers obviously our regional deliveries as well, because we supply right out to Scarborough, Settle, Selby, Northallerton, all of our huge rural area.
So my name's Will Greenwood. I'm a clinical locality manager for one of the community care teams. During the pandemic, I've been redeployed as a physiotherapist, mainly working in Station View and other care homes around the locality. So my role during the outbreak was to rehabilitate patients in a care setting that had been discharged from hospital. The intention was that the patients, as soon as they were made medically fit or declared medically fit in the hospital setting, they would be discharged to our care, where we would pick up the rehabilitation. We would then rehab them in our facilities, and as soon as we felt they were safe to be discharged home, we would facilitate that discharge, liaising closely with a supported discharge service, who would then pick up the rehab in their homes, and would also talk very closely with the social care and social services so that they would get all the appropriate care that they needed in home. The focus really was getting the throughput through the hospital to release bed space there, and focus on rehabilitating people in their home. It's always nice to treat patients. They're what got me into physiotherapy in the first place, so I thoroughly enjoyed my time in redeployment. A few weeks in, I was given a set team, and I was able to create a lot more structure to my working day, which ultimately helped the patients because I was able to focus more time on individuals and deliver more continuity of care. So I enjoyed my time whilst I was redeployed, and I'm still doing 1 day a week in that redeployed role. However, I really enjoy my job, and I've thoroughly enjoyed returning to it, although there's a lot of catch up to do now. The feeling within our team was a positive one. All of our team were redeployed staff. We had staff members that had pulled out from the hospital, from other community jobs, other clinical jobs, and we were all really trying to pull together as best we could to meet the needs of the patients, always putting the patient's needs first and foremost. Because we were a new team, there was a lot of learning that needed to go on in quite rapid sequence. So if there was ever something that we didn't know, we would have to ring around other teams to find that knowledge and adapt to it quite quickly. We would have to link back to our management who were based in the hospital quite frequently to ask questions, and also reaching out to other services such as social services and the management and care staff within the homes themselves. So it was enjoyable. I think everyone pulled together really well. From my perception, everyone seemed to enjoy their work, and patients, we had a really good feedback from patients. In fact, I've had more thanks from the patients in this role than probably most of my roles going backwards. So I think they appreciated what we were doing, and that it was all uncertain times. But overall, a very positive attitude and pulling together.
Well, I'd like to thank everybody for those wonderful presentations and for recording their experiences. I hope that's brought to life for our members just what a fantastic team of people work here at Harrogate and District NHS Foundation Trust. It's been very, very moving, and I'd like to thank them all. We've now come to your questions. We received one question in advance of the meeting, and I'm hoping that Dr. Jackie Andrews, our Executive Medical Director, is going to actually introduce the question and provide a response. Jackie.
Thank you, Angela, and thank you for the question, which was around the testing that currently is in place in the national system, the test and trace system, the so-called Pillar 1 testing. And the question was around some of the very well publicised challenges around people having to travel very long distances, often when they had COVID symptoms, to get a test. And I share, of course, those frustrations and challenges, but that is with the national system and isn't part of the HDFT system, so we can't really comment on that within this annual general meeting. But to follow up on that for our staff and family, we're working very hard to have a robust system. Of course, we do want people to use the national system as and when they can, but we also do have a system here at the Trust that if you're unable to access a system, then we are able to, through our internal processes, have our colleagues tested with the current turnaround time aiming for less than 24 hours to keep people working, keep people safe. But obviously it's a very big topic, but can't really say much more on that for now. Thank you.
Thank you, Jackie, and thank you to Heather for the question. Just a reminder that you access the chat box by finding the little thing that looks like a speech bubble on your toolbar, and you should be able to then get into the chat box if you would like to ask a question. We've got two questions which I'm going to ask Tim Gold to roll into one, and then Tim will pass on back to Jackie Andrews for some of the more medical detail around it. And they relate to, first of all, how we're managing with referrals and the backlog of elective surgery. That's from Jules Preston, an old friend of the Trust. And also Connor has asked about how we're preparing for winter against the backdrop of a potential surge in coronavirus. So Tim, can you start and then go, and then if Jackie can then pick up after you. Thank you.
Take yourself off mute, Tim.
Apologies. Thanks, Angela. So dealing with elective first. The first thing we do is clinically review all of our patients on the waiting list. So that means we are regularly reviewing them and categorising according to those that are most clinically urgent and need to be brought in for surgery. And it's those patients we bring in first. The second thing we've done is created what we call ultra green pathways. So they are pathways that are as COVID secure as they can be. And we pre-assess our patients and screen them and test them in advance. And we have dedicated staff to work on those green areas of the hospital. And that means that patients can be, we can be assured as possible that they are free of COVID when they come in, and they will also be safe when they're in the hospital. We've also increased our capacity through the independent sector. So we, through the national contracts, are using our relationship with BMI Duchy, and we've created 10 additional theatre sessions a week. And we're using that primarily for our orthopaedic pathway, so things like joint replacements, and that will continue for much of the remainder of the year.
Oh.
Mute.
You've hit me, Tim.
Sorry. Okay. It is worth saying that we have 4 patients in the hospital with COVID currently, and that compares to something in the region of 60 at peak. So we're a long way short of the first peak. What are we doing? Well, we know for winter we'll need extra beds, so that's extra general beds. We're also running a capital scheme to improve our intensive care unit, which will create an extra intensive care bed. And we're also creating a provision to create a further 8 high dependency beds if we need them for a COVID second surge. And we have a really clear plan that steps up from the 4 patients that we have now up to potentially 100 COVID inpatients as to which wards we would need to open when and what that means from a nursing and medical staffing model. But I think the most important thing is that we actually know so much more about managing COVID in the trust than we did the first time round. So I don't know if Jackie, if you want to say a bit more about that from a medical perspective.
Yes, thanks, Tim. That nicely leads into the fact that the hospital as a system has prepared very well for the next wave, but also as clinicians, we have been preparing all through the summer for what we all knew was the inevitable next wave of the pandemic. It feels very different this time. That's not to say we're being complacent in any shape or form, but inevitably with the global pandemic, with the first wave, there's an awful lot of confusion and a bit of chaos, and you very much are learning as you go from countries that have gone before you. There was a lot of blind alleys during the first wave of various drugs. You can remember things like hydroxychloroquine, which were touted as being the next big thing, which through proper evidence-based care, a lot of that research which was done here in the UK and the NHS has now shown proven treatments that we now have that can help manage the effect of the virus on the body and also prevent that catastrophic inflammation that can happen in the body where people become very poorly very rapidly. So treatments are better, but almost more importantly, we're better at supporting people with the illness. We're better at knowing what kind of oxygen and ventilation they require, how to look after their kidneys, how to prevent them getting blood clots, all those things that we had to learn on the hoof really. We feel much better prepared for that. And we've been preparing all through the summer, and most importantly really it's made us function as a system, and we learn across Yorkshire and Humber and regionally and nationally, learning from colleagues, drawing on experience. So I think, you know, from a clinical point of view, we are much better prepared, but you know, we can't second guess everything, and we are very much learning still about this, but definitely feel more prepared than we were come February, March.
Thanks very much, Tim and Jackie. Connor has asked another question, which is, will the government continue to cover the £1 million a month costs for PPE, staffing and testing? And Jonathan's got the pleasure of answering that one. Jonathan, can you put your... Jonathan's camera is on. Sorry, this is what's called a little technical hitch.
Yeah.
We can't get to Jonathan?
Do you want to do the next question?
Right, we'll do the next question then, which is, well, let's hope we don't have a technical hitch here. Lindsay has asked, how is the Nightingale Hospital being used by the Trust currently? Well, this there's an obvious person to answer this. You may know that Steve Russell, our Chief Executive, was seconded to lead the development of the Nightingale Hospital back in March. And he is currently still the Chief Executive of the Nightingale Hospital. So hopefully, Steve, the red box will get around you and you can answer that one.
Thanks, Angela. I think I'm more pleased that that question has come to me rather than the PPE cost one. So I'm hoping that Paul will be able to move the red box to Jonathan. Otherwise, I might have to attempt to answer that question. So, Lindsay, thank you for the question. It's a good and really important one. So at the moment, the Nightingale remains on standby. for the purpose that it was originally set up for, which was to be an insurance policy in the event that a large expansion of critical care capacity was needed. It's important to remember that it's not our first point of call, because every single trust, as Tim has just mentioned, has plans in place to cope with increased numbers of patients if they need critical care within our hospitals. And that's the best first place to treat people if we need to expand our critical care service. But the Nightingale remains as a facility on standby. It's ready to reactivate if necessary. That said, for those colleagues on this session who are residents of Harrogate or pass through Harrogate, you'll see that there is a CT scanner down at Nightingale, and we are currently using that CT scanner to undertake scans for patients that have been waiting during the pandemic, or who are now being referred in and need a diagnostic test as part of their pathway. We're not the only trust that's using it, so we're using that alongside our colleagues at Leeds Teaching Hospitals and some other trusts in Yorkshire and Humber. And so far, it's been an incredibly well received service. We adapted a little bit of Nightingale for a waiting area, and it's possibly the nicest waiting area I've seen ever. And one of the colleagues at the convention centre very, very kindly donated some wonderful artwork, which I'm hoping I might be able to repatriate at some point. So hopefully that answers the question, and I am hopeful that the red box may move to Jonathan.
Cheers. Thanks, everyone. And thanks, Connor, for your question. Bit of a shame. I was looking forward to Steve having a go at answering that one, but I'll have a go. I'll have a go at answering that one now. The answer to your question is effectively yes. I mean, the way we are going to get our funding in the second half of the year has changed, and I'll just go through that in a moment. But effectively, the costs of COVID will be reimbursed. In the first half of the year, we were claiming the costs on a kind of retrospective basis, so every month we would claim the cost of COVID. Going forward from October the 1st, so from this week onwards, we will receive an allocation of funding to the whole of North Yorkshire and York system. We've been allocated £24 million to cover the cost of COVID across the whole of North Yorkshire and York, and we're working with our partners and in other organisations like York Trust and the CCGs to make sure that we cover all the costs of COVID across North Yorkshire and York. But effectively, the answer is yes, the government is still covering the cost of COVID for the second half of the year as well. Thank you.
Thanks very much, Jonathan. Well, we have no more questions, so we're getting towards the end of our annual members meeting. So thank you again for joining us. It's been interesting. As predicted, it's not been without its technical hitches, but it would have been very unusual if it had. And we've managed it. We've stayed calm and we've got there. So thank you very much. I hope you've enjoyed the experience, and I hope you found the meeting informative. Again, I would just like to say a very big thank you to everybody everywhere who has been so supportive and kind during the pandemic. And we have channeled your support through the Harrogate Hospital and Community Charity. And so we're going to finish with a short film which really shares with you the generosity of those people who have been so kind through the period of the pandemic. Just before I do that, I just would like to say, please stay safe and please keep others safe. After the film of the charity, that will be the end of the annual members meeting, and you won't be coming back to any more presentations. So thank you again.
Harrogate Hospital and Community Charity and Volunteer Team coordinated all of the donations from local individuals, partnerships, community and businesses. We made sure that all of those very kind and generous donations were delivered to our acute and community colleagues across the patch that HDFT covers. We had a huge range of donations, from Easter eggs, ice pops, pasta, toilet rolls, all the way through to essential items. We set up a pop-up shop for staff and colleagues and made sure that essential items were available for them. This was particularly helpful during the first phase when supermarkets were running short on stock. We made sure that our community colleagues had deliveries where they flagged this to us with volunteer drivers. The pop-up shop was a huge resource to our staff and colleagues. We've had some fantastic case studies from staff across the patch being able to utilise these resources. Some people were unable to get to shops and essential items were delivered to them. We also had colleagues that had financial difficulties because their family circumstances changed. We were then able to offer food parcels to our colleagues and make sure they had essential items. This helped to reduce the pressure. It was really humbling to see the difference that this made, and thank you to those in the community and the Pop-Up Shop Facebook group who supported this wholeheartedly. I'd like to thank, on behalf of the charity, everybody who donated, whether that be financial donations or whether it be goods in kind or their time. Our volunteers gave up something that was priceless, and that was time. On behalf of everybody here at HDFT and Harrogate Integrated Facilities, I just want to say thank you very much for all that you have done to support us during this first wave of COVID. We're going to continue our role in supporting the Trust and colleagues and make sure that the pop-up shop remains for now. We're going to make sure that we've got essential items ready for staff so that should anybody need anything, we're there at hand to have that delivered. We'll also make sure that those that require food parcels have them from the charity as well, and we'll arrange for them to be delivered through our volunteer drivers. Thank you very much for all your help and support on behalf of everybody here at Harrogate Hospital and Community Charity and volunteer team.
We supply 2 deliveries a week to the shop. We raise the money through raffles and other events that we do on a weekly basis with support from the local community. I got involved through a neighbour who lives just down the street, and it kind of all evolved from there really. We supply drinks, snack shots, mug shots, pasta, noodles, biscuits, crisps, pop, all sorts. Just stuff that they can grab and go basically. The feedback that we've had from staff is amazing because it just means that they can nip in. If they haven't got stuff, they can nip in, grab it and go, and it's kind of, for us it's kind of, we focus mainly on the energy stuff that kind of they can grab, go, gives them energy, and away they go. Met some amazing friends within the group, and I've probably formed lifelong friendships that I would never have got if I hadn't have joined this group. So the appreciation from the staff is massive. We as a group always worry, are we sending enough in, are we putting enough in, are we putting the right stuff in, and the staff always appreciate everything, and they always say what you're giving us is amazing, we love it, it's great, don't worry about it, everything. The shop's always full and they love it.